Welcome back, everyone. Today, we're going to dig into a really fascinating new study that looks at the true prevalence of heart disease in dogs and cats. You know, we all have a gut feeling about how common it is, but what do the numbers actually say? Well, this analysis gives us a remarkably clear picture from inside a single busy university clinic.
All right, but before we jump in, you know the drill. If you get something out of these breakdowns, hitting that like button, subscribing, it really does make a huge difference. Thanks so much for that. Okay, let's get to the science.
So let me ask you this right off the bat. Thinking about your own practice, your own caseload, what percentage of your patients would you guess have some kind of heart condition? We all know it's common, right? But pinning down a real number can be tough. Well, that's exactly what a group of researchers in Cluj-Napoca decided to figure out.
And that really gets to the heart of the issue, doesn't it? The knowledge gap. We've all got the textbook stats, but detailed local data, that's often missing. This study set out to fill that void, to give us a real snapshot of what's going on, which is so important for raising awareness for both clinicians and owners.
So how did they do it? How did they get these numbers? Let's take a quick look at their methods, because, understanding the how is what makes the results so credible and so powerful.
The team did what's called a retrospective analysis. They went back through the records at the Veterinary University in Cluj-Napoca, looking at every single patient that had a cardiac exam. All told, that's over 1,700 animals, and as you can see, the vast majority, about 81%, were dogs.
And here are the specifics. They looked at a 30-month window of data, all from this one university clinic. Now, that single-center focus is actually really important. This isn't a huge nationwide survey, it's a deep dive into one hospital's caseload, which gives us this incredibly detailed, granular picture.
Okay, now for the good stuff, the results. Let's start with the dogs. They had over 1,300 of them in the study. So what did the data actually show?
The first big number that jumps out is this one, 63%.
And that is just a huge number. I mean, think about what that means. For every 3 dogs that came in for a cardiac exam over this 2.5-year period, 2 of them walked out with a diagnosis. The takeaway here is massive. For patients presenting for a cardiac workup, disease isn't just common, it's the norm.
But it gets even more interesting when you break that down. This wasn't some random mix of a dozen different heart problems. No, one condition absolutely dominated the charts: myxomatous mitral valve disease, or MMVD. It accounted for a whopping 44% of diagnoses. I mean, look at the chart. Other stuff like pulmonary hypertension or DCM, they were just blips on the radar in comparison.
And when you zoom in on that huge chunk of MMVD cases, a very clear profile pops up. This is overwhelmingly a disease of older dogs. Senior and geriatric patients made up 95% of the cases. We also see that males are more affected, about 2/3 of them. And, no surprise to anyone in practice, small breeds are the ones at highest risk.
All right, time to switch gears and talk about the cats. And as you're about to see, the data from the 3,227 feline patients tells a totally different story.
And this right here shows the first major difference. That 63% in dogs was huge, right? Well, the overall prevalence in cats was way lower, at 35%. Now, don't get me wrong, that's still a big number, more than 1 in 3 cats examined. But it's not the overwhelming majority we saw in dogs.
And the differences just keep coming. The main culprit in cats isn't MMVD at all. Nope. For them, the most common diagnosis by a long shot was hypertrophic cardiomyopathy, or HCM.
And if you want to talk about a strong signal in the data, wow, just look at this breakdown for HCM. A staggering 85% of the cats diagnosed were male. That isn't just a trend. It's an overwhelming predisposition that is frankly impossible to ignore in the clinic.
Here's another key difference from the dogs. Remember how MMVD was a disease of old age? Well, half of the HCM cases in this study were found in young adult cats. And the most affected breeds? European and British Shorthairs, which also happen to be the most common breeds in their study population.
So, we've looked at the data for both species. But what does this all mean for us, on the clinic floor? Let's boil this down to the key takeaways for your practice. Okay, this table is where it all comes together. It's just a perfect snapshot of the whole story. You can see those differences clear as day right next to each other. Prevalence? Way higher in dogs. The top diagnosis? Completely different diseases. MMVD for dogs, HCM for cats. And the age? Total opposites. Old dogs versus young adult cats.
The only real similarity is that male predisposition, and even that is way more extreme in cats with HCM. It's just such a powerful reminder, isn't it? Cardiac disease is absolutely not a one-size-fits-all problem.
And the authors themselves really see this as a foundation. They know it's just a single-center study, and they say right in the paper that they hope this work inspires a bigger multi-center investigation down the line to paint an even clearer picture.
So this leaves us with a really important question to think about. How does data like this change what you do? Does it make you even more likely to push for a thorough cardiac exam on every senior small breed dog? And does it raise your suspicion just a little bit higher for HCM when that young male cat comes in for a routine checkup?
And that's our breakdown for today. If you found this valuable and you want to help us keep digging into the science, please consider checking out the Buy a Coffee link in the description. Thanks so much for watching, and we'll see you in the next explainer.